It may sound like something that could only happen on a fictional TV show, but the incidence of surgeons leaving a foreign object behind in the body is very real.
Having something left behind in the body during surgery is more common than you might think at hospitals across the United States. The kind of objects that can be left behind during surgeries are the instruments that surgeons might use during the procedures, needles that they might use while suturing the body, or sponges that are used to pack the area open so that they can see the surgical field. The traditional way of preventing retained foreign objects is to do a count of the materials that are used for the surgery, counting the number of sponges, counting the number of instruments on an instrument tray. But we are human beings after all, and even though we count and may recount, it is possible those counts can be in error.
In its continuing efforts to improve patient safety, the University of Michigan Health System is taking on this challenge.
Having a foreign object left behind in the body during a surgery is something we consider a never event. It's something which should never happen. Unfortunately, particularly in complex surgical cases that involve emergencies or in very large patients, things can be left behind in the body, and we want to do everything we can to prevent that. The initiative to reduce the number, if not completely eliminate, retained foreign objects was one that was developed by the operating room management team working with the Quality Improvement Program at the University of Michigan. They felt it was particularly important to their environment to take this on as an initiative. Discrepancy in the surgical barcode counts. One of the first things to be done will be for the surgeon to look in the surgical field for something that may have been overlooked. If the sponge can't be accounted for by the surgeon, we will do an X-ray in the operating room looking for the sponge. Each sponge contains a tag on it which is radiopaque, allowing us to see it on an X-ray. In order to facilitate looking for retained foreign objects, radiology has partnered with the surgical team to facilitate doing the X-rays in the OR quickly, communicating to the radiologist what is being looked for, and communicating back to the surgeon if something has been found. There are no retained foreign objects, so you're all clear. The University of Michigan is leading the way in reducing retained foreign objects in the operating room. It's the combination of using new technologies as well as culture change, teamwork, and collaboration that's making that possible. While it's important for the University of Michigan to be the safest hospital in the country, it's also important that the best practices we learn here and develop here are used elsewhere to improve safety for patients in other healthcare environments.